Good day, my name is Anigo James. I'll be introducing my group work with the topic drug-fruit interaction. We'll be telling you guys about definition, the mechanism of action, the probability of taking these combined agents, and the clinical implications. By definition, drug-fruit interaction occurs when some certain fruits affect the absorption, the metabolism, and the effectiveness of this drug, thereby affecting the level in the body, causing some potential adverse effects and reducing the potency and efficacy of this drug. By the probability, this can depend on some certain factors like the demographics, the health conditions, and some dietary habits. In determining this, it is challenging to get a specified and a specific data for this probability. But generally, some individuals do take this drug and fruit combined regularly. But determining this probability is challenging due to some certain factors like variability in drug interaction, awareness and education, dietary habits, individual differences, and variability in interaction. Thank you.
I'll be taking you guys on the mechanisms of action of drug-fruit interaction. The first mechanism is alteration of drug absorption. It occurs when certain food components interferes with the absorption of drug in the gastrointestinal tract. Example is grapefruit. Grapefruit contains furanofumarins like bergamottin and 6,7-dihydrobergamottin, which inhibits the activity of drug metabolizing enzymes like cytochrome P450-3A4 enzyme, responsible for the metabolism of drugs like statins, calcium channel blockers, and immunosuppressants. Example, when someone takes atorvastatin with grapefruit, the components contained in the grapefruit will inhibit these drug metabolizing enzymes, thereby increasing the absorption of this drug and then potentially causing adverse effects and toxicity. One mechanism is inhibition of drug metabolism. When certain fruit components inhibit the activity of drug metabolizing enzyme, there is increase in absorption, leading to toxicity and other adverse effects. Example is grapefruit. Grapefruit inhibits cytochrome P450 enzyme, responsible for the metabolism of different drugs like statins and immunosuppressants. And when this occurs, the absorption is increased and therefore leading to toxicity and other adverse effects.
Good day, my name is Ishmael Precious. So I'll be continuing my previous talk on the mechanism of drug-fruit interaction. The next one should be enhancing of drug metabolism. So here, certain foods interact with certain drugs and increase action of metabolizing enzymes, thereby increasing the metabolism and affecting its efficacy. Example of such foods is cranberry juice. Cranberry juice contains flavonoids such as quercetin, chemferol that interact with certain drugs and increase the action of metabolizing enzymes. Example of those enzymes is cytochrome 2C9 and cytochrome 3A4. So now we talk about the drugs that is affected here. Example of such drug is atorvastatin, which is a drug that reduces cholesterol level. So when they interact with cranberry juice, they cause side effects such as myopathy. Another drug is warfarin, an anticoagulant. Interact with this cranberry juice, they cause side effects such as bleeding. The second mechanism of action is interaction with transport proteins. So certain foods interact with transport proteins and inhibit drugs that are transported by such proteins in the body. Hence, it reduces the distribution of such drugs in the body. So examples of such transport proteins, big lipoprotein and organic anion transport polypeptide. Now, example of the food that interacts with transport protein is pomegranates. So pomegranates contain polyphenolic compounds such as ellagic acid that interact with these transport proteins and inhibit drugs that are substrate to these transport proteins. Then our final one from me is influencing of drug elimination or altering of drug elimination. Certain foods interact with certain drugs and inhibit the elimination of such drugs from the body. So when this happens, the effect it leads to toxicity of such drugs. Now we have watermelon. Example of such fruit is watermelon. Watermelon generally affects this group of drugs because it has high potassium content. And when it affects those drugs, it leads to hyperkalemia, which is another side effect of these drugs. So now example of such drugs is ACEI, angiotensin converting enzyme inhibitor, which is a drug used in treatment of hypertension and heart failure. And watermelon is given concomitantly with this drug. they cause hyperkalemia. Now, example of another drug is beta blocker, which is also used in treatment of hypertension and heart failure.
Hi guys, I'm Austin and I'm talking about making other mechanisms of action of drug-fruit interaction. One of them is the antagonistic effect. Some drugs, when taken with fruit, the fruit is a metabolite that inhibits the action of the drug. Example, Ophorin is an anticoagulant, which helps in breakthrough or increases bleeding. When taken with patients are killed, which releases some metabolites such as vitamin K, which also is a clotting factor. This clotting factor inhibits the action of Ophorin, thereby decreasing its effect. Another example is aspirin, which also inhibits platelet aggregates. When taken with foods such as kiwi, which releases vitamin K, this vitamin K reduces its effects. And other mechanism of action is AC inhibitors on banana. AC inhibitors direct blood vessels, thereby lowering blood pressure. When taken with banana increases the potassium level of the blood. This potassium level, when increased, inhibits the action or block the action of these AC inhibitors. Another example is pomegranate and blood thinners. So this pomegranate releases vitamin K. So when taken with blood thinners such as aspirin or clopidogrel, when taken with them, this pomegranate reduces the effect of this aspirin and clopidogrel, thereby reducing their effects.
Good day guys, my name is Samuel. I'll be continuing from where my colleagues also. I'll be talking about the clinical significance of drug-fruit interaction. This one is multi-range. Example of this is interaction between grapefruit and certain fruit. Now, grapefruit contains some compounds such as chlorochlorines, which can inhibit the cytochrome enzymes responsible for the metabolism of statin drugs such as chlorostatin and atorvastatin. Now, this inhibition of this enzyme can cause increase of statin growth in the body, leading to potential muscle damage.
Number 2 is sedation. This can be seen in the interaction between apple fruit, cranberry, and benzodiazepine drugs. Example is azoprolan. So apple fruit contains some compound that can inhibit the enzyme cytochrome 3A4, which is responsible for the metabolism of benzodiazepine drugs. Now this will lead to the increase of benzodiazepine in the blood circulation, leading to the increased sedation.
3 is bleeding. This can be seen in the interaction between cranberry juice and warfarin drug. Now, cranberry juice contains compound that can inhibit the enzyme cytochrome B2C9 enzyme, which is responsible for the metabolism of warfarin drugs. Inhibition of these enzymes will lead to increase of warfarin, increased concentration of warfarin in the body, which potentially leads to bleeding. Other clinical significance include altered cardiac rhythm, increased hypoglycemia.
So, in conclusion, some certain types of fruits can interact with some medications. They could either possibly induce the metabolizing enzyme in the body, thereby leading to high elimination of the drug, or they can inhibit the metabolizing enzyme in the body and increasing the concentration of the drug in the body. Some certain drugs like atorvastatin, simvastatin, felodipine, tacrolimus, carbamazepine are greatly affected by grapefruit juice. Cranberry juice can affect warfarin, leading to excessive thinning of the blood. Oranges can affect artemisinin-based combination therapy. This drug causes an increase in oxidative stress in the body, and oranges are antioxidants. So before you take any fruit while on any medication, it is best advised for you to talk to your pharmacist because they know better and they would advise you on it. Thanks.